during pregnancy is very common. It occurs in up to 50% of women to varying degrees during the course of their pregnancy. Spotting during pregnancy or light bleeding is almost never a concern. It can be caused by various things, sometimes during or after sexual intercourse during pregnancy, or even from an exam in the office. The pregnancy hormones affect the tissue on your cervix and in the vagina, making them more fragile, so any contact with those tissues can lead to spotting. And again, that's not a major concern. Heavier vaginal bleeding, or bleeding like you would get during your period, is more of a concern. In early pregnancy, heavy vaginal bleeding can be a sign of an impending miscarriage. Usually, if a patient is having a miscarriage, they will experience moderate to severe cramping along with the bleeding. If you experience heavy vaginal bleeding early in pregnancy, you should call your OB provider. Another possible cause for heavy vaginal bleeding in early pregnancy is an ectopic pregnancy, which occurs when the fertilized egg implants someplace other than the uterine cavity. Ectopic pregnancies are a medical emergency because if left untreated, the fallopian tubes can rupture and this can cause internal bleeding. With any heavy vaginal bleeding early in pregnancy, you should contact your OB provider immediately. Generally, an ultrasound will be performed to determine the cause of the bleeding, and likely you'll have some blood tests performed to determine the level of the pregnancy hormone, or HCG level, and to determine whether or not you're becoming anemic due to the bleeding. Your OBGYN provider will try to make a prompt diagnosis and come up with a care plan suitable for your situation.